Hi, I'm Leader Renzo Mabel. This is my video 2. So the first question I was asked was, how would you describe the communication that occurred between the provider and the patient? I feel like it wasn't as good as it could have been because, like it says on slide 10, that communication can get complicated via the doctor's missed messages. You know, the doctors ask you for explanations and then they interrupt you. Second question would be, how did the provider's interruptions of the patient's communication contribute to or detract from the provider's information gathering? On slide 13, it says that patients can be displeased when a physician threatens dignity and disrespectful communication. If you keep cutting off the patient, they're not gonna feel comfortable in explaining things to you, and they're gonna feel uncomfortable the whole time if you just keep cutting them off. And like I even point back to slide 10, that communication can get complicated because via the doctor's mixed messages. You know, like I said, they ask for explanations and then they interrupt you. The third question is, what did students learn about communicating with patient from this example? I feel like they learned that it might not always be easy communicating with patients, but that when they give you such broad answers as Ms. Jones did, you should do tests so you can check off the boxes to get to the main issue. Question 4 was, describe how the provider's nonverbal behaviors communicated his or her status, role, and what specific examples support your observations. I really don't understand the question, but if I can answer this question, I feel like he non-verbally explained that he was a teaching doctor because he kept asking her, like he thanked her at the beginning, thank you for allowing the students to come in and observe our discussion. And he said at the end, he was talking about that he's gonna get the students to step out of the room when he does the blood and urine test. So question 5 was, what verbal communication from the patient would you like to have expanded? I feel like there was a lot that she could have expanded on, but I know she was in pain, and I know how that can affect you. Trust me, I know, because I've had kidney stones, and it was hard for me to explain to the doctor when I was going through that because I didn't know what was going on. But like it says on slide 10 of the PowerPoint, patients have a hard time putting ideas into words. And it is, like I said, when I had kidney stones, it was very hard for me to tell them, it's a pain in my lower back because I didn't know what was going on. You know, it's a hard time. It's very hard. You can have a hard time when you're in pain. You know, it's hard to explain yourself. I know it is. Question 6 was, I'm sorry. What verbal communication from the provider would you like to change? I feel like the provider should have explained why they asked if she had if she's ever had abdominal surgery. Like it says on slide 14, patients want to be well informed, and I feel like she wasn't. I feel like the doctor didn't explain why. It was very vague, and you know, like why did the provider ask, did she have abdominal surgery? We don't know. So I feel like they could have explained that more to the patient. Question 7 is identify 3 or 4 behaviors that would help to enhance an interpersonal relationship between the provider and the patient. Like I read on the slide that it says that, you know, honesty is key because, you know, the patient wants you to be honest. If it's something critical, they want to know what's going on. Partnership, work with the patient. You know, we have a common goal. It's a common goal. They're trying to figure out what's wrong with them, and you're trying to figure out what's wrong with them. So you got to work together. You know, make a partnership. And then the other thing that it said is interest in the patient as a person. I feel like the doctor was asking a lot of questions of like, you know, did you see does it burn when you pee? Are you on a pill? I feel like they were trying to ask some questions like, have they been having like sexual intercourse? You know, I hate to say that, but but I feel like that's what they were trying to ask because they were asking all these things without asking it. And I understand that, there's a line, you don't want to be in people's business like that. So I felt like they were trying to ask that question. Question A was, why is interpersonal relationship important to the provider and patient interactions? I mean, one thing that comes to mind. My mom always says, people don't care how much you know till they know how much you care. And like it says on slide 13, the doctor should listen and acknowledge the emotions of the patient. People really don't care until they know how much you. They don't really care how much you know until they know how much you care. So you should try to establish some type of relationship, interaction to get to know the person. You don't want to make them feel uncomfortable. It's good to try to work on an interpersonal relationship.